So this is part 3, Accommodation Conversation, and hopefully you've had the opportunity to be with us for the last 2 sessions. The last 2 sessions focused on the COVID issues in terms of the pandemic, some of the accommodation concerns that we have been hearing about and understanding are happening, from dealing with mental health in the workplace, dealing with mass vaccines, long haul COVID, and working from home, remote working, that hybrid working. So if you haven't had a chance to participate and see those sessions, make sure that you go back and take a look at those links for our Accommodation Conversations Part 1 and 2. So today we're dealing with program issues. And the purpose of this session today is to walk through the steps of accommodation, the responsibilities, the processes, and how to understand if we've met our duty to accommodate in that process. So, as I say, you'll be muted. We will have a question and answer session at the end of the presentation. About 30 minutes ago, you should have received handouts in your inbox with the Zoom link so that you can take some notes and have this for later. If you want to get any information on accommodation, ergonomics, mental health in the workplace, supporting your employees to stay at work and return to work, we have many webinars, toolkits, and workshops about these topics. So go to our online stores at gowanhealth.com or gowantraining.com, or contact us at gowanhealth@gowanhealth.com. We'd love to hear, your tough cases, the input that you want on any of this information. And if you don't see it on our website, which sometimes it's difficult to put everything that we have available on our website, ask through our email and we're happy to provide some support for you. We do have some online workshops and training over the past year. We've gone virtual. So we have our Cognitive Demands Analysis Certificate program available virtually. Online, you can go in and complete that certificate program at your own pace and be able to do cognitive demands analysis. We also have our mental health and return to work workshop that allows you to work through our online modules, case studies, and processes with a bit of consultation with myself throughout the program. We have complex accommodations in the workplace, so even more complex than we've talked about today, talking about vision, chronic pain, mental health, cognitive issues. Many different types of complex accommodations are covered in those webinars. We have our Working from Home series. So these are a series of videos that you can get as an organization and place them on your learning system to allow your employees to understand how to stay healthy, well, safe when working from home. Includes things like ergonomics, worry and uncertainty, dealing with remote working, virtually staying interactive and keeping away from isolation, and our happiness challenge. So just a small fee and you can get that for all of your employees. We also have our Psychological Health and Safety in the Workplace program. Again, online program, but with that comes some consultation on helping you to develop a mental health strategy for your workplace. And coming up, May the 12th, is our virtual CSA Work Disability Management Standards Workshop. So we will be spending a morning with you to go through those standards, the steps, and then we have some online tools and online modules to help you to implement those standards in your workplace. So you can find these and any other of our virtual offerings at www.gowantraining.com. So who am I? Well, my name's Nancy Gowan. For those of you who don't know, I'm an occupational therapist and a certified disability management professional, and over 30 years or more of experience in helping employees and employers work together to work through life's challenges, to be able to stay at work and return to work. I'm an international speaker and trainer, and I've written the book Human Resources Guide to Managing Disability in the Workplace that you can get through Carswell. And Gowan Consulting. So, who's Gowan Consulting? Well, we've been in business for over 22 years. With that, we provide Canada-wide occupational therapy services to help your employees function at work and return to work. We provide services such as ergonomics, accommodation, stay at work, return to work, mental health support, training, policy development, and of course, workshops. And our whole goal is to make the complex simple for you as an organization. We want to work together so that you can have a healthy business. So let's start. When we talk about accommodation and our conversation today, I want to let you know about the Work Disability Management Systems Standard that was published in 2020 by CSA. That this standard allows you as an organization to be able to put a system in place to ensure that you can provide the best support for employees with disabilities, injuries, and illnesses. It allows you to be able to take a look at how do you measure where you're at? How do you set up the program with the right policies, procedures, the right committees, the right authority, the right programs? How to be able to set the right metrics to measure your program and figure out what you could do better from a quality control perspective. And then how do you implement preventative and protective measures, accommodation, and training to help employees to be included in the workplace for those who have disabilities. And then, of course, how do you monitor, evaluate, and continue to improve your program? So on May the 12th, we have a standard program in place, a virtual training that if you want to know more about this standard and how to implement it in your workplace, you can join us May the 12th for that training program and be able to get also online tools and toolkits to be able to implement a good disability management program in your organization. So now let's start the conversation about accommodation. We want to talk about what are the steps in accommodation? How do you make sure that you have a process that you follow that is a solid, consistent, and fair process for anyone who requires accommodation in the workplace? To start off with, your legal responsibility for your duty to accommodate ensures that you know that not only the employer has responsibilities, but also the union and the employees have duty under your duty to accommodate legislation. So depending on where you're at, whether provincially, so I'm in Ontario, so the Ontario Human Rights Code would dictate your duty to accommodate. If you're federally regulated, the Canadian Human Rights Code. And then, of course, in each province, there is human rights codes that dictate your duty to accommodate. So in every one of those provinces and in those jurisdictions, the employer is obligated to ensure that we're not discriminating against someone with a disability. That as an employer, we have a duty to accommodate that employee with a disability to perform the essential duties of their job to the point of undue hardship. And we'll talk about undue hardship later on and what does that mean and what's that threshold. The first thing as an employer is you want to ensure that the individual has a reason for accommodation. So you want to look at the verification of disability in the workplace, and we'll talk a bit about how to do that. Also, if you as an employer see behavioral changes, you see performance changes in the workplace that are impacting that employee, you have a duty to inquire if the performance changes that you're seeing may be related to a disability. And so those are your responsibilities as an employer under your duty to accommodate. The union also has a responsibility to participate in that accommodation process and to ensure that they don't sign a collective agreement that will preclude you as an employer to offer accommodation. Now, there is respect for seniority, but if there's other collective agreement wording that might prohibit an employer from accommodating an employee, then the union needs to be working with the employer and the employee to confirm a change to that wording or to be able to write a letter that indicates that they are waiving that agreement in order to support that accommodation process. With respect to the employee also has duties around the duty to accommodate. So it is the employee's responsibility to request accommodation and share information regarding their accommodation needs. What do they need in order to be accommodated in the workplace? They also must actively cooperate in investigating options around accommodation and accept reasonable accommodation when offered. Now, if an offer of reasonable accommodation is made to the employee and they cannot accept it, the employee needs to offer an explanation as to why they might refuse that offer. What does it not achieve or allow for that person to be accommodated in the workplace? Why is it not reasonable? So those are your legal duties, roles, responsibilities, and obligations. So as an employer, you want to ensure that you've set a consistent procedure in your workplace for accommodation. You want to make sure that you manage that process consistently and fairly across the organization. That you want to ensure that you're providing education to employees, to managers, to all workplace stakeholders on the process of accommodation. This includes offering support in terms of educating healthcare providers on the fact that you have accommodation available within your workplace. And you also, as an employer, want to engage stakeholders in the process. Where do they fit in? What information do they need to provide? How are they participating in that accommodation process? The employee and the union have a responsibility to make the request for accommodation and to participate and cooperate in that process. And of course, the healthcare provider is there to be able to verify that there is in fact a disability that is needed to be protected from. Not necessarily providing a diagnosis, but being able to ensure that you're providing functional information about what the person's capabilities are, what their restrictions are, and how long that accommodation may be required. So there's several stakeholders that have responsibility within the duty to accommodate. Now, some organizations say, well, my insurer or WSIB is looking after that for me, that they're making sure that I am providing the right accommodation. And they've said that I've done my duty to accommodate, that I don't need to do anymore. One of the important things that you need to understand is as an employer, you own that duty to accommodate. So WSIB or your long-term disability carrier, your short-term disability carrier, your third-party administrator may say, don't worry, you don't need to accommodate. But if the employee comes to you and requests accommodation, you as an employer have an obligation to ensure that you've gone through that reasonable process and your procedure to determine if in fact you can accommodate that employee. Now, WSIB or WCB and the insurer may be able to help you by providing you with information from the healthcare provider around person's functional abilities and processes, but you as the employer are responsible to ensure that you've gone through your accommodation process. And I want to make that very clear that as an employer, you own it. And so no arbitrator or no law court is going to say, oh, but my LTD carrier said I didn't have to accommodate. You own that. So make sure that you've done that process. So what are those steps for accommodation that you want to ensure are within your procedures and your processes? One, how does that request for accommodation come in? So the first step is the employee needs to request accommodation, either written or verbally. Now, if the employee as we talked about before, notices changes, then the employer has a duty to inquire. But the employee may say, no, I don't need any help. And so then what they're saying is they don't need accommodation. They're not requesting accommodation. And so the next step in the process is that you offer it. But if the employee declines accommodation, your duty to accommodate may be completed. And I say may because there's always cases that are going to go one way or another. Second, the employee needs to share what accommodation is needed. The employer then determines, is there in fact a protected area for accommodation under the code or the law? Do they in fact have a disability? And together in good faith, they determine what is a reasonable accommodation for this employee. At some point in the process or in more complex cases, there is going to be a request for a third-party accommodation assessment. So if you can't come to determine what is reasonable accommodation that works for both you and the employee, then we recommend that next step of a third-party accommodation assessment so that you have an objective view of what reasonable accommodation may be possible. There's then the formal offer of reasonable accommodation to the employee, and the employee accepting that accommodation or providing a reason that they cannot accept it. Together, you write the accommodation plan, including review dates, because every accommodation plan needs to be reviewed at least annually. According to AODA standards, which is the Ontario Accessibility for Ontarians with Disabilities Act. But it is also important that you have regular review. You want to implement the accommodation and evaluate the accommodation to ensure that it is in fact effective, it's working for both the employee and the employer and allows them to complete the essential duties of the job. And again, all long-term accommodations need to be reviewed. So this is just an example of a request for accommodation form. You may have a different process, a different form. You may say the employee just needs to ask, but we've kind of provided this sample of a request form that might come in as an employee or maybe going through an interview, and they may say, I need it. Accommodation for an ASL interpreter to be present during the interview, during the testing process, or it may be many different reasons why the accommodation is needed. You'll note in this request form, and it's probably pretty small on your screen, but at the bottom, we have included a checklist for that employee to check off what they understand as their responsibilities. That they may be asked to provide additional information from their healthcare provider. They may be asked to participate in a third-party accommodation assessment. They understand that in providing accommodation, the expectation will be that they're able to perform the essential duties of the role with the accommodation. They agree to participate in determining a reasonable accommodation, and they agree to accept reasonable accommodation or provide an explanation if it's not suitable at the time of offer. So we've kind of put the employee's responsibilities in with the request form and asked them to submit that. With that, we then will review the accommodation. So do you really need to verify if someone has a disability? So here's our what we're seeing in terms of the law and in terms of the process, that during application, interview, and testing, it's probably a waste of time to look at verification. Just providing that accommodation at that time is best practice, good faith, and no verification is needed. At the point of hiring and request for longer term accommodation, or any time during the employment life cycle, we do recommend that you have a fitness for work form or a functional abilities form that you might call it. Many people call it different things that you do get from if it's a disability related, a regulated healthcare provider, to be able to understand the physical, cognitive, psychological, and behavioral capabilities and restrictions of the employee, verified by their healthcare provider. You do not need diagnosis, and it is not for you as an employer, you do not want to be requesting diagnosis. So once you've received that request and that verification, you want to investigate and research various forms of accommodation and alternate solutions. So when we talk about that, we're not talking about diagnosis and impairment. I don't care if you have kaboobalabalopolis, that doesn't tell me what you need in the workplace. So what you're really wanting to understand as an employer providing accommodation is, what is the employee's functional capacity? What is their abilities? What can they complete in terms of hours? Their lifting capabilities, their focus, their concentration, their cognitive abilities. And then what does the job demand require? And looking to compare the two to see if there's a gap. From the healthcare provider, you may receive medical restrictions and contraindications for temporary accommodations, or even more permanent accommodations, where someone, it is a medical risk if they complete that job. But really, your focus most of the time is really on functional capacity, the person's ability to do the job, and the work environment and how that impacts things. So I usually show this during our training. It says, this is Linus and Lucy. And Linus says, I can't go to school today. And Lucy says, if you're not feeling well, that's certainly a good excuse. And Lucy says, you're probably wise just to stay in bed. And Linus says, I have a knot in one of my shoelaces. So one of the most important things in terms of determining what is the accommodation and what do we need is having a good accommodation discussion. Now, if Lucy would have asked the right questions of Linus, Lucy would have been able to help with untying those shoes and getting the knot out of the shoelace, and he would be able to go to school. So it is important to develop a good accommodation discussion with the employee. Understand their need. Stay task focused. So what does the job require? And then consider options to fill gaps between what they can do and what they can't do and what the job requires. Start small and low tech. It doesn't have to be expensive. In many cases, accommodations are just work adjustments that you might make for any other employee in the workplace. But engage the employee and the manager in a good accommodation discussion. When we look at how we used to manage accommodations, we used to say, hey, doc, what's the diagnosis and what's the restrictions and limitations? Can you tell us what that person needs for accommodation or return to work? And then we'd come back down and the HR and manager would look at it and say, okay, we can do that. And the employee would be given a, here's the return to work plan, here's the accommodation plan. What we know in terms of the research and in terms of success factors is let's go bottom up. Let's talk worker and supervisor. Let's talk about the job. What changes might help you to be able to achieve that? What other equipment, what kinds of things have worked for you in the past? Discuss the employee's limitations, any possible accommodations, and the supervisor and employee in most situations can come up with a good accommodation plan. But we also want to then make sure that plan comes through HR to make sure that you have consistency across your organization, and also to ensure that you're not setting a precedent in one part of your organization that you can't offer consistently to every employee. So HR should be involved in that process of checking to make sure that we followed the right process, the right policies. We then can go back out to the healthcare provider and say, are there any risks in terms of this employee doing this accommodation? Is there anything we've missed? Anything else that we need to be aware of? And then implement. We know that this is more successful and better in accommodation because it's going to work for the employee and the employer. Now, many of you behind the scenes there are saying, yeah, but the employee is going to ask for what they want. They may. So you can always verify this in terms of being able to go to the family doctor, going to the healthcare provider, going to a third-party assessment to verify that it's in fact needed, if it does have a significant impact on your ability to implement the program. Perhaps it's a high cost, you have an occupational health and safety kind of risk factor you're concerned about. So this does not take out that extra assessment in those cases where it's more complex. So we like to use this grid as kind of a communication around the job tasks. So let's break down the job. What can you do? What can't you do? What do you think you might be able to do? What tools, what things can help you in this situation? And then we create a job match. This is what the job requires. This is what the employee can do. Here's our gaps, and here's our possible accommodation plan. So in a physical situation, the person might have to lift 25 pounds every 10 minutes, but the employee at that point can only lift 25 pounds every 20 minutes. So we've got a gap in the amount of lift. So do we give them lifting tools? Do we alternate lifts with another employee? Is it temporary? Is it permanent? Do we need to look at different packaging? There's many different things that you can do around that accommodation plan. But it really comes down to understanding, what does the job require? What can the employee do, or what's restricted? And then what's our gap so that we can fill that gap. And so ultimately, you need to find what does the workplace require, and what can the worker do? And your optimal fit for accommodation is somewhere in that center piece so that you can help that employee to complete the essential duties of the job. Now, there's different resources out there to help with that conversation. And so we've provided a few of those to be able to help with, what the job requires, what the employee requires, and possible accommodations. And we're also very happy to help you with other resources that can help with that conversation. So when do we engage an expert or a third-party assessment? Well, In very simple situations or temporary accommodation, you may not need an expert to be able to assist in that. But when it becomes more complex, like we talked about in the last couple of conversations, you may want to have an objective third party assessment because we don't always think about all the possibilities. And when we're getting to the point where we think, oh, I can't accommodate that, and what they're asking for is seeming unrealistic, it's going to cost me too much, I'm worried about health and safety, then you may want to bring in a third party to do that workplace accommodation assessment. And then what we would do in our workplace accommodation assessments is we provide assessment of the person's functional abilities. We'll do an objective assessment of what they're capable of doing, what kind of restrictions there might be, how long that person is going to have that ability. Is it going to progress so that the person is having less ability later on? And we would then do a very good assessment of the job demands and compare the two to find the gaps. We would be interviewing the manager, the employee, engaging the stakeholders in that objective assessment. We would observe the employee performing the role, do standardized, non-standardized testing, functional testing, and review the work environment and be able to determine what accommodations might be appropriate and give you as an employer a list of here's the things that would help. Here's the costs that you might be considering. We can weigh out, is there an occupational health and safety risk for that employee, for coworkers, for the public, and be able to give you a good report to assess that person objectively, that job objectively, and give you the options and possibilities. And so every day we're doing these accommodation assessments to be able to provide people with the right tools to be successful in the workplace. Our occupational therapists are regulated health professionals with the ability to understand the health condition, the workplace demands within the context of the work environment, and determining tools and strategies to support function on the job. Right now with COVID, we're doing many virtual accommodations, and we have objective virtual assessments that we can do. We can be observing people through some of the platforms like these Zoom things. And we also go on site in person to be able to look at the job and the workplace. And we've had significant success in keeping employees at work in a successful job. So 99% of the time, the person can do the essential duties of their job. And with those accommodations, that allows you to retain and employees, ensure that the employees are successful in completing their job metrics and performance. And with some job coaching, some implementation of tools and strategies, individuals with very complex conditions are able to be successful in the workplace. But one of the core things in all of your accommodation process is to consult with the employee. Because the employee is the one doing the job, the one with the health condition, we want to ensure that that employee is engaged and collaborating in the possible and potential ways to be able to do that job. And the accommodation methods may be very wide and changing. So some of it may require that you as an organization might have to tolerate some non-culpable absenteeism to attend appointments. Or if someone has a flare-up or has a condition where they may need to work less hours or different hours, flexible hours. The courts have shown that we need to be very creative in our accommodation process. Things like changes to equipment and physical setup would be expected, work schedule changes, modifications to the duties of the position, maybe unbundling non-essential tasks so that they're completing core essential tasks, reassignment of duties, training. I think the main thing you want to keep in mind, though, is there is no obligation to displace another employee. So if the employee says, my accommodation, I want to have that job. I want to have your job. You can say, you can have my job some days, but that employee can't displace you and can't displace another employee to be able to be accommodated. We do expect you're going to spend some money to invest in the accommodation process, but you've invested in this employee, and this investment is small compared to your return on investment in keeping that employee retained and doing that work. We want to ensure that we're not compromising another worker's or public safety in the accommodations. And so that's one of those things that might lead to undue hardship. Is should that employee say, I want an accommodation, but I know that I have seizures once in a while. They've been under control and I haven't had one lately, but I'd like to run the forklift, and I think that's reasonable. So you as an employer may say, I want you to be able to do that job, but unfortunately it does put at risk other workers, and so it does lead to a health and safety concern. Or you may be in healthcare or in first responders or in a transit operation, and so public safety may be at risk. So you do need to consider occupational health and safety of the coworkers and of the public. Now, if that employee says, I do have seizures once in a while, but I feel I can do my job in the office, they are able to take some risk to themselves to stay employed. So the legislation has shown, and the decisions have shown, that someone who works in the office and might have a seizure, that's a risk that is okay for that employee to take, as it's not putting other workers or public safety at risk. So it is a big piece for you to consider in the accommodations. What are the health and safety requirements and what are the risks, so that you make sure that there is a reasonable accommodation to keep everybody safe. And the other thing is, the courts have shown that you do not need to create a new job. Now, we have seen in a number of organizations bundling and unbundling of tasks within a same job category. So if we take healthcare and nursing, we may be bundling and bundling tasks still under that nursing job. That is still, it's not considered creating a new job. But say I am a healthcare organization and you say, well, you know what? Could you create a job for this person to sell, you know, sell something in a shop? And if that's not a job already and it's not within the core pieces of the business and core pieces of the job, it is not required for you as an employer to create a new job. We have seen a number of organizations where they have modified work pools. So for temporary accommodation, they may be moved to an alternate job. They may be doing sorting of things, or they may be doing tasks that are more related to the whole workplace. But we want to be careful that that is just temporary accommodation and not permanent accommodation, because you may be creating a whole new job for that individual. And especially if you're in a unionized environment, you may find that the union will say, that person's been in that job for, they've been in there for a year and you've been able to accommodate them. We'd like to rate that job and we'd like that as part of our job categories. So you may find that leads you as an organization into more difficult things. So be careful when you choose the accommodation, that you choose it first with the person's own job, and then look at alternate jobs that are available, alternate jobs across your organization that are available, and then looking at part-time or other opportunities that may allow the person to do the job. You also want to ensure when you're developing accommodations, The purpose of the accommodation is for the person to complete the essential duties of the job within the obligations around productivity and metrics, and what are those expectations. So set expectations in the role. You may start off when someone's coming back or getting into the role to gradually increase the metrics, gradually increase the responsibility so the person moves back to their regular amount of performance or productivity. But you want to make sure that this is written within the accommodation plan. What are the expectations of the job? What are the metrics? Is the person going to be able to be 80% productive? Or how will they be measured? So having that as part of the accommodation plan is important. We find that one of the last things that we want to do is, after we've put in all the accommodations, is taking away metrics or requirements around the job is very difficult and can lead to other people within the organization, coworkers, supervisors, not being able to um, support that employee. And you want to be very cautious about saying it's okay, they're working 20% and they're still working, but is that accommodation? That is beyond your duty as an employer to accept someone who is completing 20% of their job and getting paid full time. The other thing is you want a clear process for implementing your accommodations. So make sure your accommodation plans are written with clear roles, responsibilities, detail the accommodation, how will it be implemented, when will it be reviewed, what are the outcome measures, are we looking at attendance, are we looking at performance, are we looking at other metrics, and who's going to monitor the accommodation program. So ensure that that's written in your accommodation plan. And finally, you'll want to figure out, so have I met my duty to accommodate? When do I get to undue hardship? When is it too much is too much? Well, it's an individualized assessment here. So accommodation for one person does not equal the same accommodation for someone else. So this comic says, sorry, Rhodes, but if I let you go home, I'd have to do the same if any employee had a heart attack. So being consistent and fair in your accommodation process does not mean that everybody gets the same accommodation. That, as you can see when we've worked through this process, that it is a very individualized accommodation process. You don't want to say, okay, the only way we bring somebody back into the workplace is 2, 4, 6, 8, and it's got to be within 4 weeks or we don't accommodate. That the person, everybody gets support to gradually come back into the workplace. Everyone has the same ergonomics equipment, the same tools. That doesn't make sense because it's the same for your organization as well, and each employee needs something different. So your accommodation is going to be individualized to the employee's capabilities as well as the job. So what are some questions that you want to ask through that process? Does the employee have a disability? Can the employee do the essential duties of the job with the accommodations? And then being able to say, now with those accommodations, what's the cost of those? Are there a health and safety risk? Is it reasonable for us to be able to do this for the length of time or the time period and still carry out the business? And is there an impact on coworkers or the public? And so those are your guidelines in terms of trying to determine if you've met undue hardship. So you want to evaluate your accommodations, document the process very clearly, and you want to ensure that each person in that stakeholder process has the ability to say, this is working. You know, this is appropriate. This works. And you, as the employer, have the obligation around duty to accommodate, but you know that everybody is going to provide some input in this process. So you want to, as the employer, document your response to that request. So when did you get that request? You want to be timely and doing this in good faith. So it can't take you 6 months or a year to accommodate someone. You want to do it as quickly as possible so the person can get back or get into the job and be productive. You can decide whether you've granted that or declined that. And then you want to make sure that you've notified that employee of your decision and why, so that they have a documented letter to say, here's your accommodation. This is what we're providing for you. Here's the accommodation plan, how long it is, and when we're going to review it again. We are going to require additional information from your healthcare provider at this point in time. So you want that all to be within the letter to be able to help that employee to know what their accommodation plan is and what their responsibilities are. You also want to include, do you need additional information? Are you going to be asking for a accommodation assessment at a certain point in time? And then what are those results of that process? So the better you document in your file, your process, your consistent and fair response to the accommodation request, the better it's going to be for you if someone has concern about it, someone grieves that, or takes you through that process of legal accommodation. So through this process, you want to ensure that you're implementing a full work disability management system within your organization. So accommodation is just a piece of that there are several other components that we'll talk about when we do our work disability management system standards training on May the 12th. So this discussion today is just a piece of what we'll be able to cover with you on May the 12th and be able to provide you with additional tools, strategies, things that can help you in the accommodation process. So if you'd like to join us, and I know that you all will, we've got a whole bunch of people on here that I'm sure you've come to find out more about what's going on in terms of the laws, the decisions, and how you can make your work disability system better. So go to www.gowantraining.com/store and sign up for our work disability system standard training. It will help you to answer your questions around not only accommodation, but how do you manage work disability from start to finish throughout the employment life cycle, and make sure that you have the systems, the processes, the objectives, the metrics that you need to have a good, solid work disability systems program in your organization. Why do you want to do that? Because it saves you not only money, but it also saves you in having employees that feel supported, that feel able to do their job well. And as we've talked about in the last 3 sessions, there's a lot of complexity in supporting and managing individuals with disabilities in your workplace. Not only with the pandemic, but with every day that you have an employee who says, I need some help and support. Well, we'll talk about how to do that and how to make sure that your organization have the tools, the strategies, the processes in place to do that well. And it also has good return on investment. You can retain valued employees and ensure that you are not losing money on lost time, on accommodations gone wrong. We know that it costs probably about $250,000 in legal fees to go to the Supreme Court of Canada with one of your accommodations. So $395.50 is going to save you a lot. You don't want to be one of the ones that we share in those legal decisions. In our training, we want to be showing you how you can prevent some of those challenges that accommodation and helping people with disabilities in your workplaces, we can make it easy. We'll help you to make the complex simple. So go sign up and let's answer some questions. Do you have some questions that you'd like us to talk about with respect to what we covered today? So I'm going to the chat box and we have a question that says, what is defined as essential duties? And how are they different from job responsibilities identified on the job description? So essential duties are, when I look at essential duties, it is defined by the employer, but it is looking at the outcome of the job. And so what are the essential things that I have to be able to do to be able to achieve the outcome of my job? And so that may be, let's talk about making coffee. Although this is virtual world, so making coffee is essential for everybody right now. But if I was in the office and I came in early and I was, part of my duties where I'm a receptionist, and part of my things is I'm one of the first ones in, so I'll make coffee in the lunchroom for everybody as part of what I do first thing in the morning. But my outcome of my reception duties is really to be able to ensure that anyone coming in the door or phoning get to the right place, get to the right location. Making coffee isn't really essential for me to be able to make sure that those individuals get into where they need to go or get to the right department or are welcomed appropriately. But if I work at Tim Hortons or I work at Starbucks, making coffee is an essential duty. That is what I do. If I'm not able to make coffee, I'm not able to do my job. So that's the difference between non-essential and essential duties is, why am I paid? I'm paid to have what outcome? And so therefore, what duties do I have to do to be able to make that outcome? And if I took one of those away and I still couldn't meet that outcome, it probably was essential. So that's kind of a guideline that I use, but you as an employer gets to define what those essential duties are as to why you brought that person in. There's another question. It says, I have a question. How can we, as the employer, manage suspicious requests that lack objective medical support? This is always the challenge. So we always start out with the right conversation with that employee. But if you feel through that process that you don't have sufficient information with respect to how that employee can be safely accommodated, then we recommend that third-party objective accommodation assessment. Because going back to the healthcare provider, going back to other healthcare providers, doing an IME here or there and whatever is just going to get dueling opinions. You really do want a functional accommodation assessment so that an objective assessment of the person's abilities and the job demands can be assessed to provide you with what is necessary and reasonable accommodation versus what is preferred. Hope that helps. Next question, how can employers accommodate individuals who are fluctuating concentration abilities around mental health concerns? Mental health, as we talked about in part 2, is challenging. And mental health is considered as part of those episodic and chronic conditions. And so it is challenging to be able to take a look at what does that individual need. Again, I would recommend an objective functional assessment of the person's cognitive abilities and what causes that individual to have those fluctuating concentration. Because it may be that the accommodation that is being put in place isn't meeting that person's abilities around concentration. And there may be accommodations around concentration that work 100% of the time or work all the time that can be put in place even if sometimes my concentration is good, sometimes my concentration is bad, those accommodations in terms of episodic accommodations would be considered. So it may be something, and I'm like a change in the environment. Sorry, excuse me. Or it may be how the work is doled out in terms of micro breaks, or being able to utilize different tools at different times. The next question, I have a question as well. If we have difficulty getting physicians to complete forms indicating restrictions or limitations, any suggestions? We often get that they should be off 4 weeks, no other information. We do not request more and often have to go through a lengthy process trying to get more information. So, one, be careful what you ask for. So, asking a physician to be able to list what someone can lift, what someone can do physically is going to be based on diagnosis and not necessarily based on objective assessment. So if it is, you may be asking the wrong question of the wrong healthcare provider. So you may go to, say, a physiotherapist, a chiropractor, an occupational therapist who may be able to provide more clear restrictions and limitations around physical capabilities. In terms of if you don't get the right information, it's okay to challenge. It's okay to say, thank you very much for the 4 weeks and no other information. This is the information we require in order to be able to accommodate this employee. Can you please, if you are unable to provide this from your objective assessment, please let us know so that we can ensure the person has the appropriate assessment. So that's when you may bring in a accommodation assessment to help with that process. So again, that's pieces that we'll cover on May the 12th, even in more detail about the tools that you can have in your toolkit to be able to get the right information from the right professional. Another question, how do you handle a situation where employees go off on a leave but refuse to stay in communication with HR? Text, emails, phone calls are all being ignored. So again, join us May 12th and we'll give you lots of information about that. But it really is in your policies and procedures. If you have within your roles and responsibilities within your policies and procedures that the employee is required to stay in contact and what that is defined as, then you as an organization can let the employee know their roles and responsibilities and let them know the consequences of not following those policies and procedures. So under WSIB, for example, it may be the fact that or it is the role and the responsibility of both the employer and employee to stay in regular contact. So benefits may be impacted. There may be other things that the benefit provider may need to have that communication in order to confirm the adjudication or the access to benefits. But starts with the right policies and procedures from your perspective. Another question, is it good practice that employee classifications be painted with the same brush for accommodations, regardless of differences in each individual job, current responsibilities, or location and environment? So again, as we talked about accommodations are individual to the employee's capabilities and the employee's job. So if the individual job, current responsibilities, and location and environment are different and the employee's capabilities are different, the job accommodation is going to be different. So those organizations that say, we only provide these accommodations for mental health concerns, we only provide these accommodations for this type of job, have not looked at it from an individualized perspective. And so the legal decisions out there, in fact, say that you must take that approach of individualizing your accommodation. Okay. So those of you who missed the second webinar, we do have links provided. I believe you'll get that when you get the link for this one, or check your email to show what the link is. If you missed a webinar, let us know. Go Gowan Health at gowanhealth.com, and we'll get you the link for any of the recorded webinars that we have. Is there any questions? We're kind of getting to the end. Oh my goodness, it's 1:30. Well, I think we've come to the end of our time. And of course, we want to welcome you to ask us any accommodation questions. Give us a call, email us, check out our websites for resources that are available for you. And we're happy to help you with an accommodation assessment for any of your employees. Just give us a call and talk about whether it's appropriate, and we definitely would be able to help you at Gowan Consulting. I'd like to take this opportunity to thank you for joining us throughout this session. Keep an eye out, because May is Mental Health Month, and there may be some free webinars in May around mental health. So we hope that you all can join us during that time. Take a look at our social media, take a look at the newsletters that have been going out, and we welcome you to join us in May. And don't forget about our Manager Mental Health training in May on May 18th, and our CSA Disability Management training on May the 12th. Join us at gowantraining.com. You can sign up for any of those trainings that may be coming along. I really appreciate that you've taken the time to be with us today, and we'd love to help you to answer any of your accommodation questions. So have a safe, healthy, and productive day, and hope you're ready for Mental Health Month in May, and we can help you to get ready if you need some more supports. Take care. Talk to you soon.